Hello, everyone, and thank you for joining us for today's virtual press conference and research briefing. We will get started in just a moment. I did want to share a couple of reminders with you. One, this event is being recorded. Two, after the speaking program, we hope to have a couple minutes to take questions. Be ready to raise your hand at the end if you have questions. And in the meantime, the chat is open. So if you want to say hello, we always welcome that. You put your name, organization, location. We love to see where folks are joining from. With that, I am very pleased to introduce the President and CEO of United We, Wendy Doyle.
Thank you, Channing, and thank you all for being here today to discuss this important topic. I want to thank our research team at the University of Arkansas's Office of Education Policy, who I'll introduce in a moment. I'm excited that we have Senator Breann Davis here with us today, as well as representatives of Governor Huckabee Sanders and Lieutenant Governor Rutledge. Thank you for being here. But first, I'll give a little background on who we are. United We is a nonprofit, nonpartisan think and do tank, and we're focused on elevating women's labor force participation to strengthen our economy. At United We believe that the fastest way to unlock economic growth is by advancing women's labor force participation, and studies confirm that. According to McKinsey, achieving the economic potential of women in work could add $2.1 trillion to our gross domestic product. The way we advance our work for change is through a simple but powerful approach: research, solutions, results. We produce groundbreaking research that exposes the barriers that hold women back from achieving their full economic potential and lights the way toward evidence-based, nonpartisan solutions that get results. Right now, we're focused on providing actionable research that drives results in 4 states: Kansas, Missouri, Oklahoma, and right here in Arkansas, because what we learn here helps inform solutions that can benefit Arkansas women and families and others across the country. One consistent takeaway from the dozens of research reports we've conducted is the lack of affordable, accessible childcare. Childcare is too expensive and too scarce, and it's keeping women out of the workforce, harming productivity and weakening our economy. Elder care is a growing issue as well. There is no state in America where childcare is affordable, and Arkansas is no exception. On average, Arkansas families need to spend more than a quarter of their income, about 26%, on the highest quality full-time infant care in Arkansas, more than 3 times the threshold for affordability. Fixing our broken care economy will take sustained effort and investment, but one of the simplest and cheapest steps that states can take to increase supply of childcare providers is to streamline and rationalize licensing regulations. United We's national study on childcare regulations in every state revealed the complicated web of red tape providers need to navigate. From Illinois, which requires daycare providers to carry coins on field trips, to here in Arkansas, where educators used to have to go through 2 separate sets of background checks, but progress has been made. While some of these rules are important to protect health and safety, others are simply duplicative, burdensome, or just plain outdated. This decreases the supply of childcare providers and increases costs for Arkansas families. That's why we're excited to talk about the results of a year-long research study we commissioned in partnership with the University of Arkansas's Office for Education Policy, with the intent to be a resource and a partner to the many people working tirelessly to strengthen the Arkansas childcare system. Our goals in this study were threefold. First, conduct a comprehensive review of Arkansas's early childhood licensing process. 2, identify potential barriers in the licensing process, particularly in rural areas. And 3, offer recommendations, policy recommendations to remove these barriers and improve accessibility. I want to acknowledge that this is a difficult and uncertain time for childcare providers in Arkansas, and that there's no quick or simple solution to this complex challenge. And while the study does not directly address the recent developments relating to childcare subsidies, it does shed light on the broad spectrum of challenges facing providers and offer a range of nonpartisan solutions for addressing them. One major goal of all of our work is to give decision makers and policymakers better data to help them make better decisions for the people they serve. That's why I'm so honored we're joined by Arkansas State Senator Breanne Davis. Senator Davis is a mother of four who was elected to state senate in 2018 after serving 9 years on the Russellville School Board. She's been a champion for children and families in the state of Arkansas and was a sponsor of the 2023 LEARNS Act. Senator Davis, welcome, and thank you so much for being here.
Unmute. Okay, I think I'm on now. Thank you. Thank you for having me. Thank you to United We for the work that you guys have done and are continuing to do. And thank you to all the educators on the call. I know you guys have very tough jobs and meaningful jobs, and to all of those that work in early childhood and are working to help our kids become good little kindergartners and kindergarten ready. So thank you for the work that you do. I am a 9 year school board veteran. I served on the local school board for 9 years. So before coming to the Senate for the last 7 years, that was work that I did and cared deeply about. It's important that we have, parents involved and people from all walks of life coming together to work on education issues facing our kids in the system. So I also had kids for 16 years straight in daycare. So I'm familiar from the parent angle on what that looks like. And my youngest, having Down syndrome, we spent 6 years in an EIDT daycare facility and loved it and had great experiences. In the Arkansas legislature, out of 135 members, there's roughly 5 women that have kids that are even school age, much less kids that are anywhere close to daycare age. So I think it's important for us to be engaged and have a seat at the table and hear from you guys and the challenges and some of the experiences that we've had trying to work and have kids in daycare and understanding the struggles that face facilities and also women trying to go back to work. We know in Arkansas that women are drastically underemployed. And that's due in large part, I think, to having childcare options available in all areas across the state. So I was the lead sponsor of the LEARNS Act, and it was historic reforms in education, but it really was a team effort. Senator Jane English, who has chaired the Education Committee for years now, has done tremendous work over the years trying to dig in and solve real issues. And I know the governor is the same way, really looking to make a difference in her time. And I certainly don't speak for her in any way, but one thing that I'm excited about is hearing some of the information and data that you guys have, because for us as policymakers and the governor spending so much time trying to make Arkansas better, it's really about, do the policies work? Is what we're doing when put into action, is it making a difference? And that's what I'm excited to hear about today. I want to know what's working and what isn't, because we spend our time doing this and we want it to be better. And we want to help better serve you guys and help better serve kids across the state. So thank you for having me. And I'm excited to hear some of the information and look forward to hearing from the U of A research team on what they found out.
Thank you, Senator, for your leadership and service and for all you do for Arkansas families. I know we're all eager to dig into the research findings. And so with that, I'll turn it over to our research team, Ashley Daniel and Dr. Sarah McKenzie.
Thank you, Wendy, for the opportunity to be here today and to dig more deeply into the barriers that are affecting childcare capacity in the state. I was an early childhood provider before I ended up working in K-12 education, and I think it's really important to focus on that we're giving our youngest kids the best opportunities possible. So our research included a review of all the existing resources that are out there about childcare licensing and lots of direct engagement with stakeholders. We did structured interviews with providers. Some of you may be on the call, and gave them an opportunity to voice their experiences with navigating the system. In total, we conducted approximately 50 interviews and 6 focus groups with stakeholders, experts, advocacy groups, and providers. So overall, providers described the licensing process as necessary but burdensome. And the enforcement was very inconsistent, and the rules were very confusing in their experience. Small providers especially struggled with the background check delays and portal inefficiencies and high costs of compliance. And while supportive licensing specialists and peer networks earned praise, providers consistently called for more consistency between those licensing specialists and better clarity. Ashley?
Thank you, Sarah. Through our research, we identified 6 core barriers to expanding childcare access. The first is regulatory complexity, such as long timelines, overlapping inspections, and unclear rules. For example, childcare providers often face duplicative rules because they must meet both state licensing requirements and local approvals like zoning, fire, and health inspections. These agencies sometimes check the same things separately, causing extra paperwork, delays, and confusion. Providers also say that some steps are out of order. For instance, they may need proof of insurance to get a business or childcare license, but they can't get insurance until they have that license. On top of that, the state has different categories of childcare programs with overlapping standards, so it's not always clear which rules apply, especially when a facility grows, moves locations, changes owners, or operates in multiple buildings. Other barriers that were identified were financial strain, workforce shortages, zoning conflicts, the reliance on federal funding, and family child care hurdles. We found that rural providers especially lacked the support, mentorship, and resources they needed to be successful. Rural communities are hit especially hard. Over half of Arkansas counties are considered rural, and 41% of the residents in our state live there. Many rural areas lack viable programs due to low enrollment, staffing shortages, and geographic isolation. Family child care homes are crucial but undersupported. The good news is that there are solutions, including many that are being implemented in other states, from streaming licensing and modernizing zoning laws to supporting rural family child care programs. We'll go back to Sarah.
Thank you, Ashley. So our report walks through each recommendation in detail, and you can see how each recommendation aligns with the 6 core challenges that we identified here. Our first recommendation is to streamline licensing and inspections. That's the easiest barrier to remove. The 2023 LEARNS Act actually resulted in that tangible improvement, but there's more work to do, especially when it comes to aligning state and local requirements. So in Indiana, they developed an online portal that allows childcare providers to apply for and track their licensing applications digitally. And Tennessee introduced collaborative regional teams consisting of state licensing agents, local zoning officials, and childcare providers. So that helped break down some of these complex and inconsistent requirements that childcare professionals are experiencing. Another recommendation is to provide grants and subsidized background checks. For example, explore pooled or state-backed insurance programs, or provide grants or low-interest loans to help cover facility modifications. Create clear pathways and shared background check systems. So strengthening the workforce and professional development opportunities can go a long way towards easing the burdens on childcare providers and encourage more of them to enter the market. Some states are exploring license reciprocity to facilitate the transfer of teaching credentials across state lines. Modernizing zoning laws and designating child care zones. So we recommend looking at those local zoning codes to explicitly permit childcare in residential and mixed use areas. This will remove one of the main barriers in starting up a new childcare center. Expand state funding and public-private partnerships to reduce the dependence on federal funding. I don't need to tell you how timely this recommendation is. But for example, New Mexico recently became the first U.S. state to offer free universal child care for nearly all families, and Virginia offers low-cost loans to eligible child care programs. The last recommendation is to support rural family child care, replicate successful pilot programs like Growing Opportunities for Family Care, which encourages the growth of family child care providers in underserved areas. This initiative includes funding, technical assistance, training, and financial support, including subsidies for the costs associated with licensing and certification. In Arkansas, GOFCC has been implemented along Highway 59 from Siloam Springs to Sulphur Springs. By removing these barriers, Arkansas can reduce costs, increase access, and build a stronger economy. Before we wrap up, I do want to recognize the steps that OEC has already made to revise the licensing process. As of October 25, drafts of revised child care licensing guidelines are under review. These revisions are part of a broader strategic plan aimed at enhancing early childhood education across the state. The proposed changes are expected to be presented to the Arkansas Early Childhood Commission for approval in the coming months. And then once approved, the updated guidelines will be disseminated to providers, accompanied by public-facing guidance to facilitate understanding and implementation.
Thank you, Ashley and Sarah. This is exactly the kind of nonpartisan evidence-based research we've seen drive progress across the heartland and the country, and we're so grateful to the University of Arkansas for partnering with us. But we don't want you to just take our word for it. That's why before we open it up to questions, we thought it would be helpful to hear directly from a provider who has experienced these issues firsthand. Amy Pinkston is a training coordinator with Child Care Aware of North Central Arkansas, and we're delighted she can share a few words with us today. So, Amy.
Thank you, Wendy. As Wendy mentioned, I am the training coordinator. I'm also the marketing and outreach coordinator with Child Care Aware of North Central Arkansas. And I can say that the barriers outlined in the report broadly reflect the challenges that we see on the ground. I especially appreciated the emphasis on workforce development, particularly the report's focus on low wages, turnover, and the difficulty providers have retaining qualified staff. The state data show median salaries for childcare workers remain far below those of K-12 teachers, and that pay gap creates instability in classrooms and programs. One particular challenge that we've seen in our area is meeting director qualification requirements during program startup. Finding a qualified director is one of the biggest hurdles for new providers because the training and experience needed for licensure often take longer than the 60-day window allowed before opening. This means new centers can be ready in every other way with the facility, equipment, interested families, but they're unable to open their doors simply because the director training process hasn't caught up. It's a situation that discourages expansion and makes it hard to meet the growing demand for childcare in our rural communities. Overall, I really value the effort that was made to hear from providers directly and get their feedback on the licensing process. Their voices give us essential context behind the data. As a childcare resource and referral center, we actually work hand in hand with providers from the beginning of licensing all the way throughout their time in early childhood. And I often say that we are the dot connectors. We help bridge the gaps and find out the answers that they are struggling to find. We know that the first few years of a child's life are crucial. From birth to age 5, children's brains develop more rapidly than at any other time, with actually 90% of their development occurring during this time. That's why early childhood education is such a high calling training and why investing in it yields such lasting returns for our communities and our economy. I commend this effort to center the experiences of providers and families, and I appreciate the opportunity to be with you today.
Thank you, Amy, for sharing those insights and for accepting the high calling of early childhood education as a career. We appreciate you. I should note that this is just one aspect of our work in Arkansas. Right now, we are also in the middle of statewide listening tour. We've done town halls in Rogers and Foreman and online to hear directly from women in communities across the state, and their stories and experiences will inform a qualitative report. Of course, there is no magic wand for fixing the care economy, but as you heard today, there are some simple steps that Arkansas policymakers can take to make childcare more affordable and accessible. There are also other ways that you can get involved. So first and foremost, we invest in this research to inform you. So please utilize this research report. We know it's been dropped in the chat, but it's also accessible on our website at united-we.org. Connect with us. Our website has ways you can get involved, including signing up for our newsletter, getting involved in our public policy coalitions, or attending one of our town hall sessions. So please join us and connect with us. And finally, help us spread the word and amplify this opportunity to make progress around childcare licensing. With that, we have time for a few questions, and Channing is going to moderate those. So back to you, Channing.
Thank you, Wendy. I'm going to stop sharing my screen. Hopefully you can see our panelists here today. So if you have a question, raise your hand. You should see the little hand raised icon at the bottom of your screen, and that will tell us that you have a question, and then we'll let you unmute and ask your question. So fire away. And I also want to say thanks to everybody who has chimed in with where they are in the chat. It is very, very cool to see how many providers and advocates are joining us today. And we do have a question from hopefully I will not butcher your name, Danae Ledbetter. If you can give us your name and your organization and ask your question.
Yeah, good morning. My name's Danae Ledbetter. I'm with Bentonville Preparatory School in Bentonville, Arkansas. I am the owner and executive director here. And I have a question just regarding, first of all, probably my biggest guilt when hiring employees is that I do not have the ability to offer any kind of insurance. You know, we do go through Aflac and a company called Combined, where we have short-term disability, and there's different little policies that you can put together. It does give you some reimbursement. There's some dental, but in regards to an overall health package to cover, you know, your ins and outs of what you need just to be healthy, to keep your kids healthy. And so I was just curious if that was mentioned as something that other providers would want, or is there a way for us to unite and come together and be able to offer insurance across the board, even be considered like a state employee since we have to follow state regulations? Is there a way for us down the line to be able to offer that? Because again, that's my biggest guilt, is to hire a mom of 2 or 3 kids and not be able to provide insurance.
Great question. Thank you, Danae. I saw a lot of nodding from our panel. Sarah, is there any chance you'd want to weigh in on that?
Sure, I'm happy to weigh in on it. I think this is one of the areas where it's a complicated issue, right? Because one of the things that we don't do in early childhood is contribute to the retirement system or to the benefits. So K-12 teachers, it's about 27% that of their salary that the district and the state put into benefits for them. And our child care systems are so trim on that margin, you couldn't be putting that much in. So when we looked into early childhood becoming a part of ATRS or state employees, it seems like that's not the right answer for this, but I love your idea of sort of pooling resources and getting it so that you can provide some support for your workforce. And I think these are the innovations that we need to be thinking about and looking to see what's happening in other states that we can model after. Great question.
Thank you, Danae, for that question. We have a couple questions in chat, which are also good ones related to Ashley. I know you mentioned the new regulations that are under review. A couple folks are asking, will there be a comment period for those regulations? Ashley, do you want to take that one?
Yes, we have heard that in several of the state level meetings that there will be a public comment period for those. We actually had a meeting with the OEC team yesterday. I know it's coming. I don't really know the exact details on when or the process that they're going to utilize to gain that public comment. So definitely reach out to the OEC team or the Early Childhood Commission and see what the next steps are for that implementation.
And we'll keep an eye on that and get the word out to you through OEP. If we have your emails, we will send out notification of the comment period just so you don't have to miss it.
Really, really good question. Thank you for that, Robin and Elizabeth. Okay, our next question comes from Tammy James. Tammy, go ahead.
Yes, I'm Tammy James. I'm with the Northwest Arkansas Family Child Care Association up here in Northwest Arkansas. My question has to do with where does this go from here? I'm so thankful to see this research was done. I'm thankful to see that the licensing regulations are being reviewed. I'm so very thankful to see Senator Davis here, but I actually help support family child care providers going through the licensing process. And currently I have two in a city up here in Northwest Arkansas that we cannot get through the zoning process. There's just too many barriers and obstacles. And so to hear that the recommendation was made for the zoning process to be equal with the licensing process was helpful, but I'm wondering where do these recommendations go from here? How much further are they going to go other than just being recommendations?
Tammy, that's an outstanding question. I think I could see multiple members of our panel being interested in taking that one. So why don't we, Wendy, if it's okay with you, let's first go with you and maybe just give a broad kind of brush context around how United We works with policymakers to make sure, you're raising awareness of these recommendations, not only in forums like this one, but moving forward. And then I expect Sarah and Ashley may have feedback as well.
Sure. Thank you for the great question, Tammy. And this is exactly why we invest in this research to first identify the issue, to have some data that we can then have some informed conversations with policymakers. So the next step for us as an organization, United We, is to get to work to really, share the research far and wide at all levels of government so that we can lean into what the issues are. So, thank you that you are validating that this is an issue. And then now the next step is we'll be pushing this information out to get some systemic change.
We are almost out of time, everyone, but I did just want to, Sarah and Ashley, I don't know if you wanted to weigh in on any next steps or ways people should be thinking about how to stay engaged in this work.
So at OEP, we're super excited about this work. We're having a conference in Little Rock on November 12th. That's going to have a whole early childhood component to it. There will be policymakers and philanthropists there. We are really trying to elevate the voice of our early childhood friends and sort of bring that into our larger K-12 work. We have good relationships with people at the State Department, and our whole thing is putting data into action. So we will continue to work with you. We'll continue to keep you updated on these reforms.
Thank you. All right, we're out of time. So Wendy, I'm going to let you have the last word.
Great questions. Thank you, Channing. That's all the time we have, but before we wrap up, I want to once again thank our research team for their outstanding work and Senator Davis for joining us. And if you have additional follow-up questions, I know we didn't get to everyone, know that we can continue the dialogue. You can connect with us online, and members of the media who are joining us today, you can reach out to @comms@united-we.org. Thank you all again for joining us, and have a wonderful rest of the week.